Hi everyone, how are you? Today, we're going to talk about a serious topic that can save lives, prostate cancer. Did you know that many men ignore the early signs of this disease until it's too late? What if I told you that detecting prostate cancer early can increase your chances of survival by up to 90%? That's right, this information is a game changer. Prostate cancer is the second most common type of cancer among men, affecting 1 in 8 men during their lifetime. The problem is that most of the time, the initial symptoms are so subtle that they go unnoticed. And when the disease is discovered at advanced stages, treatment becomes much more difficult. But don't panic. Today, I'm going to show you the signs you might be ignoring and how identifying them early can change everything. Let's get started. Prostate cancer doesn't always present obvious symptoms, especially in the early stages. The issue is that many men think that difficulty urinating or that little back pain is just part of aging. But what if it's not? Have you ever felt difficulty urinating as if the flow was weak or interrupted? This could be a sign that an enlarged prostate is compressing the urethra. And while this is common with aging, it could also be a warning sign of something more serious, like prostate cancer. That sudden, uncontrollable urge to run to the bathroom, even when your bladder isn't full, could be a sign that something isn't right. An enlarged prostate may be pressing on the bladder, causing this urgency. And have you ever felt like, even after urinating, there's still something left? This sensation could indicate that the bladder isn't emptying completely, and that might be a sign of prostate issues. Feeling discomfort or pressure in the rectal area could be mistaken for gas or constipation, but it could also be a sign that an enlarged prostate is pressing on nearby structures. In more advanced stages, loss of bladder control can occur. If you start needing diapers or pads, it's time to see a doctor immediately. And back pain that doesn't go away could be more than just a simple discomfort. If prostate cancer spreads to the bones, lower back pain could be one of the first signs. Finding blood in your urine or semen can be scary. And while it might be caused by other conditions like infections, it could also be a sign of prostate cancer. If you're losing weight without an apparent reason or feeling extremely tired, this could be a sign that your body is fighting something more serious. Feeling pain or burning during urination or ejaculation isn't normal and could indicate prostate problems, ranging from inflammation to cancer. While erectile dysfunction is common with aging, it can also be an early sign of prostate issues. If you're having trouble maintaining an erection, it's important to investigate. Here's the crucial point. Prostate cancer doesn't always manifest dramatically. Many of these signs can easily be ignored or confused with other conditions. But the sooner you notice these symptoms and seek medical help, the better your chances of effective treatment. Imagine this. A man starts feeling back pain or difficulty urinating and thinks it's just stress or part of aging. He ignores it until one day he notices blood in his urine or severe pain. When he finally goes to the doctor, the cancer is already advanced and treatment options are limited. Now, think of another scenario. A man notices the subtle signs early on, sees a doctor, gets the necessary tests, and discovers prostate cancer at an early stage. The chances of a cure are much higher. If you've noticed any of these symptoms, don't ignore them. See a doctor and get the necessary tests, such as a digital rectal exam, ultrasound, or even a biopsy. Remember, early detection can save your life. And if you found this information useful, don't forget to like, subscribe to the channel, and share this video with friends and family. Health is our most precious asset, and taking care of it is essential. Take care, pay attention to your body's signals. Until the next video, and may God be with you.